Hi, I'm Gil Kaplan. I'm a gastroenterologist and epidemiologist at the University of Calgary.
I'm James King. I'm a master's student in the Department of Community Health Sciences at the University of Calgary.
And today we're going to be talking about a paper published in The Lancet Gastroenterology and Hepatology titled Trends in Hospitalization Rates for Inflammatory Bowel Disease Between the Western World and Newly Industrialized Countries, a population-based study of the Organization for Economic Cooperation and Development, the OECD. So Crohn's disease and ulcerative colitis are modern disease in modern times. Ulcerative colitis was recognized in the 1800s, Crohn's disease in the 1930s. During the latter half of the 20th century, we saw a spike in the incidence of Crohn's disease and ulcerative colitis throughout the Western world, in North America, in Europe, and in Australia. Now, interestingly, at the turn of the 21st century, we saw a paradigm shift within the Western world. We saw incidence rates of Crohn's disease and ulcerative colitis actually stabilize, and in some regions, decrease. Now take this in contrast to the developing world. During the 20th century, we had sparse data on incidence of IBD in countries outside the Western world, but data that we did have suggested that incidence was quite low. But at the turn of the 21st century, we're seeing the emergence and rise in incidence of Crohn's disease and ulcerative colitis throughout newly industrialized countries in Africa, Asia, and South America. And so what James, who's a master's student here at the University of Calgary, was interested in doing was try to see, can we actually look at hospitalization rates for countries throughout the world to see if we can learn some of the patterns and trends related to hospitalizations for IBD, both in the Western world as well as countries outside the Western world.
Yeah, and so the OECD itself is this large international effort between governments throughout the world to really collaborate and hope to improve the social and economic well-being of citizens throughout the world. And so one thing that they do is collect a lot of country-level data at some of these indicators like healthcare utilization or the environment or finances. And so what we were able to do is look at hospital discharge rates for IBD over the last 25 years or so, from 1990 to 2016, and see what the trends were, and also see comparatively what countries were showing really high hospitalization rates and what countries were showing lower. And did these patterns reflect some of the epidemiological trends that have been seen with the incidence and prevalence? And so, first of all, we did a comparative analysis between these countries, looking at hospitalization rates for IBD in sort of a more recent time period. So between 2010 and 2015, we just took the average hospitalization rate and looked to see what countries were showing really high hospitalization rates and what countries were showing lower hospitalization rates. And the second thing we did was look at those temporal trends over time. So we calculated the average annual percent change for each country to see how these trends were changing and what countries might be showing signs of stabilization or even decreasing hospitalization rates. And so what was really interesting when we took these two things together, we saw that some of these countries with really high hospitalization rates, namely those in the Western world, had really high hospitalization rates, but a lot of these countries were showing a decrease or a stabilization in these rates over time. So for example, some of the areas in Scandinavia had very high hospitalization rates, but are showing stabilization or as over time. Although that's not true for all of these countries. For example, the US had quite high hospitalization rates as in recent years, but their hospitalization rates are still increasing over time. On the flip side, you have countries that are more newly industrialized in South America and Asia that are showing really low hospitalization rates overall for IBD, but showing a really significant increase over time, which is sort of mirroring that trend in the incidence that we've been seeing, where newly industrialized countries are starting to see IBD more often. And that really is another key piece in understanding how these trends are changing over time. So one thing we also looked at was just the prevalence in general of IBD in these countries. Not all countries had data on prevalence of IBD, but for the countries that did, we looked to see how associated they were together, and not surprisingly, we saw a high correlation between the prevalence of IBD in these countries as well as the hospitalization rates in these countries. And so that's just one of the factors that we explored in trying to understand why these trends are occurring and what sort of needs to be done in the future to help minimize some of these increasing trends of hospitalization rates in the newly industrialized world.
Yeah, so James, I found your results fascinating, and I think it's a really nice study looking at the global epidemiology of IBD in the context of hospitalization. It has really important implications both for the Western world as well as for newly industrialized countries in Asia and Latin America. So in the Western world, gastroenterologists like myself who are caring for patients inside hospitals as well as in our clinics, we see that where our hospitalization rates are quite high, much higher than countries in newly industrialized countries in Asia and Latin America. But importantly, many of the countries in the Western world are showing that hospitalization rates are decreasing. And likely that's a result of the advent of immunomodulators and biologics treatments that we have that keep patients out of hospital and at home. But what was really important to also recognize is that not every country had the same decrease in hospitalizations that we saw. So for example, in the US, we actually see hospitalization rates increase. And that's telling us maybe not every country or every region within a country is adopting the same kind of therapeutic opportunities as other ones. And we need to try to understand what are the factors that are really driving hospitalizations rates up and down in these different countries to help us better care for these patients with IBD. Now, on the flip side of that is looking at hospitalization rates in newly industrialized countries in Asia and Latin America where the incidence is very low, hospitalization rates are very low, but both incidence and hospitalization rates are increasing at a very high level. And what we're seeing are patterns, trends, that as these countries have become westernized, industrialized, they look more like the Western world, we see IBD increase, and of course we're going to see hospitalizations increase as well. And this is particularly relevant from a global perspective because many of these countries a generation ago didn't admit these patients on a regular basis. And so now the gastroenterologists are having to kind of contend with caring for these patients. And what we don't know yet is at what point will the incidence of IBD peak in newly industrialized countries, and how much of an impact will IBD on their healthcare system. So for these reasons, I think the global epidemiology of IBD is a really important area to look at, and this data I think helps contribute to that.